Okay, in this video we're going to go over the bones of the inferior limb, and I have a disarticulated pelvis for us to study that with. So the first bone is the hip bone, or the os coxa, which is this whole guy right here that makes up half your hip. So the os coxa is just this half. This whole thing is termed the bony pelvis. Pelvis just means or refers to this area. The bony pelvis is actually the two os coxa and the sacrum, or the sacral bone. The acetabulum of the os coxa. Within the acetabulum, we have a ring on the inside, referred to as the lunate surface of the acetabulum. Then the acetabular fossa, which is central, and the acetabular notch, which extends inferiorly from the acetabulum, so the acetabular notch. Then we have the obturator foramen of the os coxa, the ilium, which is this superior part of the bone. So the os coxa is actually divided into three different bones. You have the ilium, which is superior. Looking at it from a lateral aspect, if you were to divide this section into two bones, you'll have the pubis up here, and the pubis extends a little bit down here, and then this bottom is the ischium. So we have the ilium, which is superior, and on that we have the body of the ilium, which is this thicker portion right here. Body of the ilium, superior to that is the wing of the ilium. Along the surface, we have the iliac crest. Then the anterior superior iliac spine, the anterior inferior iliac spine, and then posteriorly to that, the posterior superior iliac spine and the posterior inferior iliac spine. Also on the back is the gluteal surface, what the gluteal muscles attached to. That means that this side is the sacropelvic surface of the ilium, where it attaches to the bony sacrum. The sacropelvic surface of the ilium. If I could disarticulate this bony sacrum from the ilium, we would find a surface back here, and that is referred to as the auricular surface of the ilium, where it attaches with the bony sacrum. Looking at the bony sacrum posteriorly, we have the iliac tuberosity. Anteriorly, we also have this indentation, which is the iliac fossa. Posteriorly, you have two notches that kind of cut into the ilium. This is the greater sciatic notch of the ilium. And then the lesser sciatic notch is not parented to any bone, it's just down here, but the lesser sciatic notch. Then if we move on to the ischium, you have the body of the ischium, which is this thicker portion. Remember, the ilium, the ischium, and the pubis are kind of all divided. In the textbook, there's actually a little grid line about there and about there. Get my paperclip right. So this would be the ramus, or the ramus of the pubis, the superior and inferior ramus of the pubis. And then here's the ischium and the ilium. So here's the ischium. It's just this kind of posterior portion. So we have the body of the ischium, and the ramus of the ischium, which extends anteriorly to meet the ramus of the pubis. And then posteriorly, we have the ischial tuber. And then for the pubis, which is right here, body, the thicker portion of the pubis is the body of the pubis. Then we have a symphysial surface of the pubis. That's where it meets the interpubic disc to connect to the other pubis at the pubic symphysis. So here's the symphysial surface of the pubis. Then along this midline is the pubic crest. Laterally, you have a little projection called the pubic tubercle. Then you're going to have a superior ramus of the pubis, like I mentioned before, and an inferior ramus of the pubis. Moving to our femur bone, With the femur bone, you have the head of the femur bone, and that's what articulates with the acetabulum of the os coccyx, so the head of the femur bone. You're going to have a neck of the femur bone. Greater trochanter of the femur bone is lateral. This would be our greater trochanter of the femur bone. Lesser trochanter of the femur bone. This indentation on the femur bone is called the Trochanteric Fossa of the femur bone. On the posterior aspect of the femur bone, from the greater trochanter to the lesser trochanter, you have the intertrochanteric crest of the femur bone, intertrochanteric line of the femur bone. The body of the femur bone extends down the diaphysis of the bone. Posteriorly, you have a subtle ridge that extends down the body as well. Linea aspera of the femur bone. Then on the distal aspect of the femur bone, you have another little indentation. This is called the popliteal surface of the femur bone. And you have your medial and lateral condyles with their respective medial and lateral epicondyles. This groove in between the two condyles is referred to as the intercondylar fossa of the femur bone. Intercondylar fossa of the femur bone. Off of the medial epicondyle of the femur bone, and it's not really shown super well on this model, but you have an adductor tubercle of the femur bone. It's like just a prominence off the medial epicondyle. On the anterior aspect, just beneath the patella, this patella is actually screwed in on this model, but if you were to remove this, you would see a groove that bifurcates into two smooth surfaces, and that's referred to as the patellar surface of the femur bone. And of course we have our patella. Our patella has a base superiorly where it's wider, and an apex similar to the heart, a base and an apex. And then you have an anterior surface of the patella, and on the posterior, what would normally be the posterior surface is the articular surface of the patella. Here's our tibia. We have a medial and lateral condyle of the tibia. So we have our, let's see, this is a left foot, so we're going to have our medial and lateral condyles of the tibia. There's going to be a anterior and posterior intercondylar area of the tibia. So anterior and posterior intercondylar area of the tibia. And in the center, this isn't accurate because this is having to attach to here to form the articulated model, but you would have a little, around in this area, you'd have a raised area, which is called the intercondylar eminence of the tibia. And on either side of that raised area, you're going to have these little, what look like horns, and they're actually called the medial and lateral intercondylar tubercle. Tubercles, plural, if we're doing both for the tibia. So a medial intercondylar tubercle of the tibia and a lateral intercondylar tubercle of the tibia. It's like a little raised prominence on both sides. And that whole thing makes up the intercondylar eminence of the tibia. Lateral aspect of the tibia, you'll have a fibular articular surface going down distally. We have our tibial tuberosity. If we turn this guy around again, on the posterior aspect of the tibia, this is the soleal line of the tibia. It's similar to the femur bone with the linea aspera, that subtle ridge, except on the tibia it's called the soleal line of the tibia. And if we go to the very distal end of the tibia, so we have a medial malleolus of the tibia. So you can actually palpate, you can feel it. You reach down and feel that bony prominence off your ankle. That's your medial malleolus of the tibia. Also on the lateral aspect of the tibia, beneath on this model where the fibula will articulate with the tibia, fibular notch of the tibia. Underneath here, similar to the carpal articular surface of the radius. In the arm, where the tibia articulates with the talus, we'll find the inferior articular surface of the tibia. Moving to the fibula, we have a head of the fibula, which is the proximal end, head of the fibula, the neck of the fibula, which is just distal to that, the body of the fibula, which runs the length of the diaphysis, the body of the fibula, and coming down, so the fibula actually touches the trochlea as well. And that's the articular surface of the lateral malleolus of the fibula, the fossa of the lateral malleolus of the fibula. Okay, so for the bones in the foot, you have our tarsal bones, which make up all these bones, proximal to the metatarsal bones. The first of which is the talus, which has a body at the thickest part, a neck, a little distal to that, and then the head, which articulates with the navicular bone. So this would be, let's see if I can get a good angle. The tibia articulates with the trochlea of the talus. The largest of the tarsal bones is the calcaneus, which makes up your heel. So here's our calcaneus, and it has a large tuber calcanei on the back. Medially, it has another projection, the sustentaculum tali of the calcaneus. Then the rest are pretty straightforward. So this is our navicular bone. Then we have a medial, intermediate, and lateral cuneiform bone. We have a cuboid bone. And then we have our first, second, third, fourth, and fifth metatarsal bones. Again, with similarity to the hand, where we have a base, a body, and a head of metacarpal bones. And then we have our 14 phalanges with the base, body, and head. And again, as with the hands, this most anterior portion will actually be designated as a tuberosity of a distal phalanx. So you would say tuberosity of the distal phalanx of the first digit of the foot.